a briefing on the COVID-19 status by the Lagos State Government. Please stay with us.
And that, in simple terms, means that we want to reduce the number of patients that we see in any period of time. This gives us some advantage in that it doesn't overwhelm our health facilities. It gives us time to engage with the international community, to use some of the experiences that our colleagues abroad have gained from the massive outbreaks that have been happening around the world, to gain the opportunity to use research results in terms of managing our patients, and also, very importantly, to take advantage of any new developments and any new knowledge that is happening in the COVID epidemic globally. So if we're able to achieve the graph that shows blue instead of the graph that shows yellow, it spreads out the infection rate so that we're seeing an acceptable number of patients on a daily or weekly basis. This will also help us not to be in a position where our infrastructure and our human resources are overwhelmed. So in principle, all the strategies that we've been adopting, and there are several strategies, as you will come to see, have been in attempt to achieve a reduced number of cases over any particular time frame. So you've seen this graph before. It's our modeling graph. And the red graph shows what would have happened if we didn't have any of our strategies. We would have been seeing thousands of cases on a weekly basis, which would have rapidly overwhelmed us. The next line shows if we had just confided our strategies to case management and isolation. The third line, the green line, shows what the modeling prediction would be if we added our case definition, isolation, management, social distancing, inclusive of public awareness. And the last line, which is the dark line at the bottom, is where all our strategies come together, inclusive of lockdown, but more importantly, inclusive of massive public awareness and community ownership. Community ownership being where we have communities of Lagos, the people of Lagos, participating with government in trying to address this outbreak. So this graph shows the number of cases that we saw as of the 1st of April. And you can see the projection in black. If we carried on at this rate, we would have been going at this tangent. The next slide shows the 8th of April. And somehow the tangent had been flattened, or what we call flattening the curve. But as of the 18th of April, it seems as if we're seeing a lot more activity from the multiplicity of our avenues through which patients reach us at the Ministry of Health. So as of the last 3 or 4 days, we've been seeing a consistent double digit in terms of new cases, and those numbers seem to be increasing. The day before yesterday, we saw 32 new cases, and yesterday we saw 23. When we combine those graphs, we can see the red line is our current projection. We had gone down to the blue line, but now we seem to be moving at a steeper gradient, which suggests that we are beginning to see more cases of infection in the community. This is just an overall schema of what's happening from our index case up until we started to import quite a few cases through the airport, and where we started our strategies of contact tracing, isolation, social distancing, lockdown, which started around the end of March, and our latest strategy is active community case searching. So we're no longer just waiting for people to present. We're actually going into the community through all the local governments, door to door, trying to establish how many people may have the symptoms that are typical of COVID-19. Our total number at the moment of active cases known to us is 306. So there is a great gradual incline in terms of the numbers of cases we're seeing per day, and we've outlined the strategies that we've deployed in the blue arrows. If we put that into context, the red line demonstrates what would have happened if we had not deployed any of the strategies. By now, we would have been seeing about 6,000 cases. But as a result of our strategies, and that reflects the blue line, you can see, despite the fact that we seem to be seeing more cases on a daily basis, we are really in a position where our strategies in Lagos State have indeed dramatically reduced the number of cases that we would have seen had we not deployed these strategies. So the blue line at the bottom there is indeed a flat curve, as opposed to this trajectory, which would have happened had we not deployed a multiplicity of very aggressive strategies in Lagos State. Some data from our active case search in community. As of yesterday, we visited just over 1 million households, which represents about 5 million people. Out of that number, we found about 29 cases of patients with what we call breathing problems or respiratory distress. And we found about 1,000 people with symptoms that could qualify as case definition for COVID-19. However, do remember that there are a multitude of viruses or other causes normally in the community that give rise to these symptoms. The question is, how many of these cases are indeed related to COVID? So far, and we've just started this exercise, out of about 300 cases sampled, we have only found 3 out of 300 patients who have symptoms and who have breathing difficulty to be related to COVID-19 virus. Most of these symptoms, indeed more than 90% of these patients, will have other causes for their respiratory symptoms. We've also been visiting a multitude of both public and private sector hospitals, and we've managed to visit just over 2,000 such facilities. Looking at the local government distribution of cases, you can see that the majority of cases are in the Lagos mainland, followed by Etiosa. And then running closely behind is Ikeja. And we're beginning to see a bit of activity in Alimosho. Of note, there are 3 local governments where we have not identified any cases of COVID-19 yet, and those are Abayomi, Ekpe, and Ojo. It appears that there are 1 or 2 clusters of infections in Alimosho, and there are several walk-in cases that come into the infectious disease hospital in Yaba. This is the profile of our cases. We have a cumulative number of 306 cases in Lagos to date, confirmed COVID. As of now, 93 have recovered fully and have been discharged. And we have 194 active cases within our isolation facilities. And unfortunately, we have recorded, as of today, 14 deaths directly related to COVID-19 infection. The age distribution and gender, once again, we're seeing most of our cases between the age of 20 and 50. And that probably represents why we have a good outcome with our patients. We would be worried about patients who would be infected over the age of 70, as this has been identified globally as a risk factor for COVID-19. Majority of our patients are male at 70%, and 30% female. In terms of the symptoms associated with COVID-19, predominantly we see fever, cough, shortness of breath, loss of taste or smell, body pains or chest pains. Many of our patients on admission actually do not have any symptoms. We are beginning to see some patients who have a significant amount of other illnesses, such as hypertension, blood pressure, and some conditions that affect the integrity of their immune system. Majority of our cases are mild. Some have moderate disease, and very few fall into the category of severe or critical. Our bed occupancy at our current active isolation facilities, infectious disease hospital in Yaba, we have 46% occupancy. So only half of our beds at Yaba infectious disease are occupied. At the Luth facility, we have 37% occupancy. And at our newly opened Onikon isolation facility, we have 47% occupancy. So the overall occupancy is 44%, giving us an excess bed capacity of 153. So right now in Lagos State, we have an excess bed capacity of 153. Bearing in mind that as we admit, we are also discharging. So that occupancy rate will go up with admissions and go down with discharges. This map just shows you the location of our isolation facilities in the Lagos mainland, Surulere, with Luth. So this is IDH, and here we have the Onikon Stadium. We're about to commission some new facilities. The landmark or Etiosa isolation facility will be commissioned on Monday with a bed capacity of 70. Bagada will be commissioned towards the end of next week with an additional bed capacity of 160. And we're currently working very fast on a new isolation facility in Yaba Infectious Disease Hospital, which will hold another 150 bed capacity. At the same time, we're moving very fast with a permanent isolation facility at the Infectious Disease Hospital with a bed capacity of 300. We're hoping that this facility may be completed in 2 to 3 months. We have additional isolation facilities, or what we describe as holding centers. We have commissioned 3 hotels in Ekpe to deal with the cross-border movement of Nigerians that are returning to the country. So far, we have about 100 of such travelers isolated in these holding facilities that are designated as Lagos State holding isolation facilities. They have been taken over by the government. We have a hotel in Lekki that was commissioned yesterday to hold mild cases or contacts of confirmed cases who we believe may have been exposed enough to become infected over a few days. We have a hotel in Victoria Island that is currently commissioned as a holding center. We have 1 hotel in Ikeja, and we have 1 private facility, medical facility in Ikoyi, which is used to support the government with critical care patients infected with COVID-19. We also had 1 marine vessel that was converted into a floating hospital when we had a number of infected oil and gas personnel. That marine vessel was temporarily converted into a holding facility until we were able to evacuate the crew members onto the Lagos Island. The involvement of the private medical facilities is a function of one of the Ministry of Health agencies, the HEFAMA agency, the Health Facilities Accreditation Management Agency. And a number of private hospitals have reached out to the Ministry of Health for assistance. They have been inadvertently exposed to COVID-19 patients. And the protocol that has been deployed by HEFAMA is to assist these facilities decontaminate. Some of them, it has been recommended that they discontinue to see patients or to admit patients until the process is complete. And they have to go through a process of infection prevention control training of all their staff. And if they go through the HEFAMA designated COVID-19 certification, then they will receive guidelines on how to manage COVID-19 patients in the future, should the case arise where government will partner with private sector to manage COVID-19 patients. This scenario may present itself if we begin to see very large numbers of cases on a day-to-day basis, and the Lagos State Ministry of Health facilities may be overwhelmed. We are anticipating and preparing for such an eventuality, and as such, we are preparing the private sector through strict guidelines and certification on how that process will be rolled out. So the Lagos State strategy at the moment continues. We have a very active helpline, the same helpline, Corona 808000 Corona. It is functional and dynamic. If you have any inquiries or if you wish to contact us, please use the 08000 Corona helpline. You will be attended to immediately. If it is for advice, we will give you advice. It is manned by professional staff and a team of doctors. If you require to be tested, you will be reached as soon as possible. And if you need medical attention, we will evacuate you to one of our isolation centers or one of our holding centers, depending on your condition. We are increasing our isolation and holding facilities, as I've just described. The idea around this is to remove as many people who are suspected or confirmed of COVID-19 from community for two reasons. One, so that we can monitor you and make sure that we prevent you from going into the complications of COVID-19, but also to protect the community, so that if you are COVID-19, that we reduce the opportunity for you to transmit the virus to your family members or to people in your community. We've embarked upon increased testing. Right now, each of our testing facilities can test up to 200 in a shift, which gives us a total testing capacity of about 600 per center. And of our 2 active testing centers, that gives us a total of 1,000 tests per day. We have, in addition, the Nigerian Institute of Medical Research that also has increasing testing capacity. We've embarked upon the active case search in community, so we're no longer relying on people to reach out to us. We are reaching out to the community to try and establish and get a sense of how much community transmission of COVID-19 virus is actually taking place. This will help us to define our policies moving forward. We are actively engaged with the private sector, as I described, in many ways. Private sector are collaborating with us to increase our isolation bed space capacity, and also in terms of human manpower, healthcare workers. We are increasing the collaboration between public and private sector to ensure that we have enough medical manpower to cope with the current situation that we see, and also to cope with increasing number of patients that may be developing complications of COVID-19 infection. We're still enforcing our social distancing and public awareness at all levels, and we are embarking on massive training of our health personnel in the skills of infection prevention, control, and intensive care training, as we anticipate that as the outbreak continues to expand, we're going to start to see more and more patients developing complications of COVID-19, particularly in the form of respiratory distress that may require ventilation or respiratory support with oxygen and other high care facilities. Thank you very much, and I'm open for questions. To my right, I have the chairman of the Health Facilities Management and Accreditation Board, who have, together with her team, have been extremely busy engaging with private sector and other facilities to ensure that we meet the guidelines and the compliance of Lagos state laws, and that the private sector are engaged in a regulated manner with the Lagos state COVID-19 strategy. At the moment, the policy, unless there are extenuating circumstances, is that all COVID-19 patients should be managed in a state facility or in a private sector facility that has been designated and subsumed by the Lagos state government as a state isolation facility. That is the strategy at the moment, and that is what we are maintaining and regulating through the HEFAMA agency. I also have with me the Honorable Commissioner for Information, Mr. Benga Omotosho, and forgive me, I did not introduce the Chairman of the Board, Dr. Mrs. Sholanke Koya. So I'm open for questions from the press. Thank you.
Gentlemen of the press, we want this section to be well organized. So we just want you to come forward here. We are going to take it 3 in a row. So after the 4 sets, the commissioner will attend to the questions. Then we take the other section also. So please.
Good afternoon, sir. My name is Amina Delegushi, health correspondent for Lagos Television. My first question is, how long does it take to get a result of COVID-19 after a sample is being collected? And for patients with underlying ailment, is it, okay, an example is someone who is meant to undergo a surgery, and then he or she gets to be a confirmed case of COVID-19. Would the treatment be obstructed? What is going to happen? Because we find out that most of the death cases recorded, majority of people with underlying ailment. How will the process be done? Thank you.
Good afternoon, sirs. I'm Mary Alale Yusuf from Channels Television. At a briefing similar to this some time ago, you mentioned your concern for Alimosho being a densely populated area. So I just want you to give us a sort of follow-up on Alimosho. You said you were going to deploy more manpower to the place to forestall rapid transmission. I just want an update on that. How did that go? Was it successful, or are you still concerned about the place? Then the second question is, you did also tell us that Yaba was going to be a center for more serious cases, while minor cases, less serious and mild and moderate cases, would be moved to Onikon. Now, Yaba bed capacity at 46%. Are you saying these are the serious cases? Thank you.
Good afternoon, sir. My name is Dayo Jerindi. I write for Punch newspaper. I have 2 questions for Honorable Commissioner for Health and 2 for the Commissioner for Information. The first for the Commissioner for Health. We have reports that some public hospitals in Lagos are turning back COVID-19 patients. Why is this happening, sir? Then second question. How many private hospitals are currently accredited to treat COVID-19 in Lagos currently? How many patients are receiving treatment in those private hospitals as we speak? And to the Information Commissioner, some markets are still operating without social distancing and use of nose mask. What's happening? Then, do you think the lockdown is working since the cases in Lagos is even increasing more during this lockdown? So my question, sir.
Honorable Commissioner, sir.
Thank you very much. Those are nice questions. So we've been increasing our testing capacity dramatically at the outset of the outbreak because of the complexity of the test. Our turnaround time for a test was between 24 and 48 hours to get a result. As of now, a test is available same day. If we get the samples in the morning, by the late afternoon or evening, we have the results. And samples that come in the late afternoon or in the evening, the test is run overnight because we have 3 shifts working 24/7. Those results will be out in the morning. So our turnaround time for testing has dramatically increased, which has made generally our operations more efficient. For the question around COVID infections associated with people who are having other procedures, whether surgery or pregnancy or any other problem, because COVID-19 can affect anybody, that becomes a clinical decision. If you have COVID-19 infection and you are due for an operation, the doctors will decide which is the priority. If your surgery is a life-saving procedure, then there will be a combination of management of the COVID infection along with the surgical intervention to ensure that we save your life from the surgical intervention that's required. However, if the surgical intervention can be delayed or whatever procedure has been planned can be delayed, then the ideal situation is that we delay such a procedure until the patient has recovered from the COVID-19 infection. Yes, if you recall the slides that I showed around Alimosho, we were concerned about some increasing activity in that densely populated local government area. Our data shows that indeed there is a very slow but gradual increase, but nowhere near what we see in mainland or Etiosa or Ikeja. But we have put in place increased surveillance. In fact, our active case search has focused primarily initially on Alimosho, and we haven't really completed the analysis of the data that is coming from Alimosho. We will have more information in the next 24 to 48 hours, but it doesn't seem that we're seeing at the moment an increased or excessive community transmission in Alimosho. As we've increased our bed capacity, the idea is that certain isolation facilities will be reserved for complicated cases and others will be reserved for mild and others will be reserved for moderate. But since we started off with the infectious disease hospital at Yaba as the main admission center, we still have large occupancy in Yaba, and as those patients are discharged, the complexity of patients in each isolation facility will change. Over time, we will keep complicated cases where we have a higher proportion of expert staff and high care facilities, and we will triage patients on admission. In other words, before the patients are picked up from their homes, we already have an idea of their severity. We will then direct them through one central command, which is based in the infectious disease hospital, we will direct the ambulance to take them to a designated isolation facility where we feel the patient will fit best. We will also put patients closest to their homes so that it's easy for their relatives and their patients to visit and give some psychosocial support during their isolation stage. The public hospitals, the general hospitals are not supposed to be turning COVID patients away. They're supposed to triage them, isolate them, and inform us of a case that is suspected of COVID, and the patients will be tested, and if the suspicion is high, we will move them immediately to one of our isolation facilities pending the result of the test. So I'm not aware of any of our general hospitals turning back patients, but if that is the case, then such a case will be investigated by the Ministry of Health. I will ask the chairman of the Pharma board to address the question around the number of hospitals, private hospitals, that have received or have requested help from the Ministry of Health, and the process of the help that we're giving to the private sector, the format of accreditation, and the strategy moving forward.
Thank you, Honorable Commissioner. Good afternoon to everybody. Regarding the question about the facilities that have been approved, as of today in Lagos State, we have one facility that has been approved by Lagos State to participate in the COVID-19 response. We do have information and requests from other facilities to get approved. The process is either through information, HEFAMA becomes aware of the fact that a hospital may be inadvertently exposed to COVID or may be seeking to manage COVID patients. We deploy our staff there so that the staff can inspect the facility according to established protocol for the facility in terms of designation of space and training for their staff. If they do meet that approval process, then the facility will be approved to participate in the COVID response. If they are not meeting the standards when we get there, they are issued a statement of deficiency and they are asked to comply and correct those deficiencies. If they do that and the staff goes back to inspect and is aware of the fact and can see conclusively that they have met the deficiencies, it is only at that time that they will get the approval to participate in the COVID response. So that is where we are in terms of the facilities. I believe there was a question about the number of patients that are in the facilities presently. In that regard, because of public safety, those numbers are not static because, as the Honorable Commissioner mentioned, sometimes the patients are admitted and sometimes the patients are discharged. So we will be very careful in communicating that type of information to you because we need to ensure that the public is aware that we're doing everything to maintain the safety of Legations. So what I can tell you right now is the number is in flux. We get patients and they do move out, whether they're discharged or they move to an isolation center in the state. Thank you very much.
Good afternoon, gentlemen. Thank you for that question, our friend from the Punch, that you have observed that some markets are not observing social distancing. Well, that is true. I've seen some markets that are not observing these crowds all over the place, and I have seen some that have been observing social distance. We established 50 markets when this whole palaver began, And some of these markets are visited. And I have seen that the neighborhood markets, people are conscious of how they cluster together, and they even want one another not to hold it together. But as from next week, you are going to see increased information, enlightenment about social distancing. Since the experts have told us that this remains the only antidote to this terrible disease, we are planning that as from next week, we should tell our people to observe social distancing better than they are doing now. We will continue to hammer it into everybody's ears, and this will continue. You also spoke about face masks. I will have allowed the Commissioner for Health to reply that question, but I think it's a question that I can easily handle. Some experts are saying that it's not being made compulsory, that as soon as it's going to be compulsory, that is going to help in this situation, that everybody will be asked to wear it. But recently, I think 2 days ago, the governors of the Southwest met, and they actually recommended that all of us should wear face masks. And I have seen that since that time, the number of people that I see wearing has actually come up. And I hope that by this week, this new week, there's going to be a decision on that. And I know that the state government is doing something along that line to see that even now that it's compulsory, people are not going to have to spend so much money to be able to get some for them to wear. Thank you.
Yeah, Honorable Commissioner, distinguished ladies and gentlemen, we'll take the next set of questions.
Good afternoon, Mr. Commissioner, sir. My name is Funke Adesoji. I report for Silverbird Television. I have 3 questions, sir. The first one is there have been alleged reports that some health workers have COVID-19 due to their exposure to patients. We just want to know how true this is, and if it is, are they being treated as we speak? And also, mother-to-child transmission. We just want to know if there's been a case like that whereby a mother, have COVID, put into bed, if the infant also, contact the disease, and if there's a case like that in one of your isolation center. And then the third one is, I know how difficult it is when it comes to, the house to house, but we just want to find out if journalists can be carried along in one of your house to house monitoring of the case. I don't know how this could be, but I hope there can be some arrangements for journalists to, be there firsthand to get to see how you get this done. Thank you.
Good afternoon. My name is Onyechi Ogu from Galaxy Television. My question borders around the death cases. Of course, according to you, you said 14 death cases as of today. We want to know how Lagos is handling these death cases, and how safe are they now to the ecosystem, especially with the fact that we had seen burial and we had seen people around the burial site. How safe are those people who attended those burial too?
Good day, sir. My name is Ben Salah. I write for The Guardian. So my first question has to do, when usually in the past, when you give updates about the number of patients who died of COVID-19, you usually tell whether they died in public facility or private facility. You just said 14 people have died. How many of them died in private facilities? 2, before now, you've said private hospitals facilities should not accommodate manage COVID-19 patients. And up until yesterday, we never knew that a private facility has been approved to manage COVID-19. So what transpired between when you said that and yesterday, and especially looking at when you said that the patients who died in the one of the patients who died in a private facility was already admitted in that facility. Three, you talked about that you'll be moving around communities and all that. One of the issues that people have taken to in precautions is the use of face masks and hand gloves. And experts have said that when they're not used properly or disposed properly, it has the likelihood of community transmission. And looking at the cases we have over, are you saying Lagos is not taking the right strategy? That is why we're having that data increase. Especially looking at, there are no efforts on the part of it, especially for people to dispose of those marks and all that. Thank you. My argument is that we've seen from your last briefing, you talked about the strategies the state government is taking and that you're going to manage, but we've seen that even from your call, I think in the last 4 days, we've exceeded the projection of the state daily in terms of the positive cases we've had. So what went wrong?
Commissioner, sir.
Yes, so by virtue of the profession, healthcare professionals are at the front line and they will be exposed to patients who display typical features of COVID, and in some cases, some patients who present to the hospital for other conditions may be asymptomatic carriers. So presenting with other things, maybe even pregnancy or coming for surgery, but they've also been infected. About 80% of patients infected with COVID-19 will display either no symptoms or very mild symptoms. So our healthcare professionals will always be at risk. In fact, community is at risk if you don't practice social distancing. But our personnel in our hospitals are trained in infection prevention control, and therefore they should be managing all patients with the universal precautions, which is what we're trained to do. So healthcare professionals should not inadvertently be exposed to COVID-19 virus. However, we are seeing a few cases in our general hospitals, and those members of staff will be isolated, and those that they've been in contact with will be isolated in our facilities, and those that they've been exposed to will be traced, and they will be isolated at home. And the medical professionals that inadvertently become infected with COVID, we will just reinforce the training of our personnel to make sure that in the future, when they recover, that they are practicing as best they can the universal precautions for infection prevention and control. Mother-to-child transmission, we have seen such a case. We admitted a mother and her child, 6 weeks old child. It's not clear how the child got infected, whether it got infected in utero, in other words, while the child was inside the womb, whether the child got infected through the breast milk, or whether the child got infected just because of the close proximity of the child to the mother. There's not enough information globally to distinguish or to give a clear indication of how a child would be infected by the mother. Research is going on, and as we see more cases around the world, that information will become clearer. I'm sure it's quite possible for us to organize that journalists accompany our active case search teams. However, there are some restrictions. You do need to undergo some degree of training for your own protection. And be reminded that there is a level of insecurity going on in the state, and some of our health personnel in the field have been exposed to some degrees of violence. So bear in mind that if you come, the process, you would have to observe the process, but we also have to protect the identity of the patients that are being screened, and many members of the public may take offense to being filmed in the process of this activity. So it's something that we will need to discuss and work out the logistics for a number of reasons that I've just mentioned. We've been studying the profile of the 14 fatalities in Lagos. By and large, most of them are of the older age group. Most of them have other existing medical conditions, particularly hypertension, diabetes, or other conditions that decrease the immune system and make them more vulnerable to COVID infection and its complications. So while we expect that COVID infection is a mild to moderate disease that is self-limiting, in other words, it goes by itself, if you have other conditions that predispose you to the complications of COVID, then the infection will linger on and persist longer, and in that situation it may get the opportunity to damage some of your vital organs like your lungs and your kidneys, thereby developing the complications of COVID-19 that may lead to death. It's also important for the public to remember that the sooner we get to know about you and the sooner we can admit you, particularly if you have mild to moderate disease, then under the supervision of our experts, we may be able to prevent you going from moderate disease to severe. And certainly we would want to prevent you from going from severe to critical. So we implore the community not to feel the urge to stay at home. You are more likely to survive a COVID-19 infection under the supervision of our experts in our isolation facilities. We have had many patients trying to present to us at the very late stages of the complications, and several of them have died en route to the hospital or when they've reached a critical state where they're desperate, and at that stage it becomes very difficult for us to rescue such patients. Our isolation facilities are very clean, they're very comfortable, our staff are professional, very friendly. In the open wards, you get to meet other COVID-19 patients, and you get to relate with a number of people, and you share your experiences. And as far as we're concerned, most patients have had a very pleasant experience, although they often describe it as a life-changing experience for them, not because of the adversity of the environment, but simply because they've been admitted into an isolation environment which is very different from a normal ward. But let me re-emphasize to the community that if you have the features of COVID-19 infection, it is important that you contact us on our 08000 Corona number, and that we are aware of your condition and that we can test you, and that if you're positive, we can bring you into one of our isolation facilities and give you the best opportunity to survive the infection. Leading on to the next question, out of the 14 fatalities that we've had, only 2 of them have happened in our infectious disease hospital in Yaba, And these 2 fatalities are examples of cases that have presented to us in a very late stage where there has been very little we could do to save their lives. Most of them have died either en route to the hospital or in private facilities where they've been trying to avoid coming to our isolation facilities. You're most likely to receive the best help and the best care if you come to us at the early stages of your infection. Regarding the private facilities, the Onikon isolation facility is a private facility. It is accredited by the government and it is subsumed by the government. The Landmark facility is a private facility. It comes under the jurisdiction of the Ministry of Health, even though it is managed to some extent by the private sector. The Lagos University Teaching Hospital is a federal hospital, it's not a state hospital, but it comes under the jurisdiction of the Ministry of Health. The First Cardiology Consultants Hospital is a hospital that has very advanced high care facilities, and they have requested that they come under the supervision of the Ministry of Health as a designated facility for patients that need extreme expertise for severe complications of COVID-19, and they have gone through the accreditation process and they are now designated as one of our isolation facilities. The story around gloves and masks, we are about to come up with a Lagos state policy in line with the recommendations. The reason we haven't done that yet is because face masks are scarce on the market, and if we make a pronouncement that everybody should wear face masks, then there will be a severe deficiency in the market which will deprive the medical personnel of access to these face masks. So we have at the moment commissioned a process whereby the tailors and seamstresses in Lagos are being empowered to produce and provide a standard of homemade face masks that the public can wear and that the public can gain access to without pulling on the already limited stock of professional medical face masks that our health professionals require. The last question regarding why we're seeing an increased numbers of cases over the last few days does not mean that we're losing control. Lagos State has yet to peak. The point we're making is that the increase in numbers of cases per day is sustained, but it is a gradual process. Had we not put these strategies in place, we would have been seeing a steep rise in the numbers of new cases per day, going from something like 20 to 50 to 100, and as you can see in Europe and the rest of the world, seeing several hundred new cases per day. Right now, we're just seeing a very gradual increase in the numbers of cases we're seeing per day, which clearly indicates that our graph is flat and that our strategies for the meantime have been effective. We know we have not peaked yet. We don't know when that peak will happen. It may take a few more months, but as long as we can keep the numbers of new cases per day just increasing at a gradual rate, then that defines our curve as being flat as opposed to a steep curve. And that also indicates that the Lagos State strategies are indeed very effective. So it's not as if we're not expecting new cases per day, an increase. We are expecting an increase. We're just grateful that that increase is very gradual. And as you can see from our bed capacity, we can certainly absorb the increase in numbers of new cases per day. And we're even making additional plans should that rate of increase of new cases per day escalate. So the data shows that our curve is still in a flat projection. I think that addresses most of the questions. Thank you.
Hello, good afternoon, sir. My name is Oluwole Ojo. I report for TV 360. And my question, most of the questions have been asked, but there's one that, continue to bother me, and people ask me. It's about the late Abayomi, and why did Lagos State allow the body to be taken out of Lagos? That is, why did you release the body to the family? Why did you, for burial? Because you said a couple of times that nobody, and I've seen as on international mediums, nobody is released to anybody. So why did the body release?
There's a list going about identifying areas where people can go for COVID-19 tests in some local government areas. I want to know, should we pay any attention to that list? And are they going to attend to just anybody? Can anybody just walk up and say, I want to get tested, I feel funny? That's one question. Then I want to ask, as at this time, if we do have really serious cases, how many ventilators do we have in Lagos State to attend to the serious or critical cases of respiratory problems? And do we have people who can operate these ventilators? The third question is, in a case, I'm asking because I've seen something similar to this. In a case where a family is infected with COVID-19, maybe a man and his wife, and they have to be taken to the center, and there's nobody to take care of the children, is there any provision for the children to be taken care of? Thank you.
Okay, sir, I would like to ask, you said the Lagos State is about to come up with a policy towards the use of face masks. The last we heard is COVID-19 airborne now. Thank you. Is COVID-19 airborne now? Why do we need to use a face mask? Thank you.
Good afternoon, sir. Good afternoon. My name is Thompson. I report for AIT. Mine was just to find out the state of the hospital where Dr. Chubu Emeka, who passed on because he had a case he was attending to in his private hospital. What's the state of the hospital? And is there anything the government is doing in that regard? Thank you.
Okay, there is no policy against the release of the deceased with COVID-19 in terms of release for burial. If you demise from any condition, there is protocol to manage every scenario. The protocol for managing death from COVID-19 is that the body is decontaminated. The body is then placed in a special body bag, and we put them in 2 body bags and then placed within a coffin, and the coffin is sealed. The family are then given the opportunity to come and collect the body and taken for burial. The only restriction around burial is that we follow the current state law on congregations and that no more than 25 people in total, including the religious members of the ceremony and the grave diggers, should not exceed 25. So family members can carry out a private burial ceremony once we've conducted the proper protocol for decontaminating the body and ensuring that the body is sealed in body bags and then further on sealed in a coffin. So there is no current policy that bars us from handing over the deceased to their family members. It just has to be done in a way that does not expose family members or does not break the current law around the numbers of people to be aggregated in one place. We have decentralized locations where you can have yourself submitted for sampling. So what we've done is to move sampling stations into the local governments, and if you feel that you have any of the symptoms associated with COVID, you can present yourself to these decentralized sampling stations. They're not testing stations, they are sampling stations. You will, if you meet the criteria for testing, you will be able to receive the counsel from the staff, and your sample will be taken. We're not just testing anybody. There is a criteria for testing. You either have to have the symptoms to meet the case definition, or perhaps to have been in very close contact with somebody that has been confirmed with COVID-19. Your sample will be taken, and it will then be sent to one of our accredited testing facilities, and those facilities will then perform the test as I described earlier. This strategy is to bring the testing opportunity closer to the people so that it will release the strain on our staff in terms of driving through several local governments, and make the opportunity for people in the local governments to present themselves for testing so that we can get a better idea of what is going on in the community, and also that we can make diagnosis of COVID-19 earlier at a local government level. So at the moment, there are between 30 and 40 ventilators in Lagos, but some of these ventilators are designated for non-COVID patients, and the others are designated for COVID. So you have to remember that you cannot mix a ventilator, put a COVID patient on a ventilator, and then after that patient comes on the ventilator, you put a normal patient on the ventilator. The COVID ventilators are dedicated, and they are in dedicated facilities inside our isolation facilities, and the non-COVID ventilators are used for non-COVID patients. We have a group of intensivists and ICU nurses or high care nurses, and we've been able to organize them into a consortium or a committee, and all the intensivists and high care nurses are currently establishing a strategy whereby Lagos State can prepare itself for an increasing number of patients that may require intensive care. The machines are being established and validated as we speak, and we will have intensive care facilities in 4 of our isolation facilities, the first one being the Yaba Infectious Disease Hospital, and soon to be followed by the Landmark Hospital in Etiosa. At the same time, those experienced intensivists and high care nurses are also assisting us to train more medical personnel so that we have at least between 100 and 200 healthcare professionals that will be able to man these high care facilities where these ventilators will be placed. This is all in anticipation of a surge whereby we're seeing a larger number of patients that need ventilation support. So far, we don't have that situation yet, but as with all things in this COVID response strategy, we are preparing for the worst, and we even have more strategies in line for should we have a sudden increase in the numbers of patients that need ventilation. Around the family clusters, that is dealt with on a cluster-to-cluster basis. Obviously, we wouldn't want to deprive a very young child of the attention of the mother, and that is where the largest issue occurs. Older children can be separated from their parents for a period of a few weeks without psychosocial injury. But when it comes to a nursing mother or a very small infant, then we try our best, if possible, to separate the infant from the mother. But where that may not be possible, then we just ensure that we have put in place a mechanism where we try our best to prevent the child from getting infected by the mother. We have seen such situations where whole family clusters exist and one or two of the parents are infected. We immediately separate one of the parents from the rest, and we try and isolate the rest of the family into single rooms, because we know that most often several of the family members will invariably and over time become infected. COVID-19 is a droplet-borne infection. It's not an airborne infection. In other words, by the process of coughing or sneezing, you produce droplets into the air with a radius of about 2 to 4 meters as of the current estimate, and therefore it is speculated that if you are COVID-19 positive and you're coughing or sneezing, you will create an aerosol around you that may expose people in the vicinity of 2 to 4 meters, thereabouts, to droplets that contain the virus. So there is some theoretical evidence that the wearing of masks may indeed reduce the amount of droplets in the environment of a person that is infected with COVID. And that is the reason why we are beginning to define a strategy of face masks for the general community. And Mr. Governor has already given the instruction that our tailors and our seamstresses should be commissioned to start mass producing face masks from local fabric according to a standard design that we have already distributed to this professional cadre, such that in the next couple of weeks we will be able to mass produce handmade, locally made face masks, not medical masks. And I repeat, we are not encouraging the public to go and purchase medical masks, because then you will deprive the medical community of the professional masks that they require for their professional activity. The wearing of a homemade mask is just to reduce the amount of droplets that you may produce aerosolized by the process of coughing and sneezing. By wearing a face mask, it doesn't protect you from COVID infection. It just protects the people around you from an increased amount of aerosol generated by the process of coughing. around the question of the hospital, the private hospital that was the scene where a doctor that demised was managing a patient. Dr. Yemisi Sholanke Koya has more details on that medical facility.
Thank you very much, Honorable Commissioner, and thank you again, everybody, and to the individual who did ask the question. The facility, as of Friday, April the 17th, has received instructions to temporarily cease the admission of new patients on inpatient basis or outpatient basis until all the standard protocol required by HEFAMA have been adequately done, and we have had the opportunity to go there and ensure that that has been done. Thank you.
So thank you very much. Once again, apologies for the long delay between press briefings. A lot is happening in Lagos State. I'd just like to encourage you that the strategies of the incident commander, Governor Babajide Sanwo-Olu, who is involved on a day-to-day basis in all the strategies that we're deploying, that those strategies are indeed bearing fruit. As you can see from the graph, the blue line represents our projection in Lagos State, and the red line represents what would have happened if the incident commander had not deployed the strategies that are currently in place in Lagos State. And not only that, we are looking very much into the future to plan ahead. It is better to be over-prepared than under-prepared. And so a lot of resources are going into long-term planning, immediate, intermediate, and long-term, to ensure that Lagosians are safe and that we minimize the impact of this outbreak. I'd like to use the opportunity to thank all the members of the cabinet who are all playing a very significant role in assisting me, as well as the incident commander, in the rollout of all these strategies, and also to thank the general public for being such a civil, obedient public, responding to all the policies of the state, and also being very organized in the current state of lockdown that exists in the state. I'd also like to thank all the private sector contributions that we've been receiving. Many of them have been deployed, and many of them have been extremely useful to the state government response to COVID-19. Thank you very much.
Gentlemen of the press, thank you very much for taking us time for this press briefing. We appreciate you all. Thank you very much.